Hi everyone, welcome to ACE ISC Psychology for video 3 on the ISC stress chapter. Today, we will discuss the effects of stress, including important concepts of burnout and the inverted U curve, which is one of the most asked sections in boards. Stay tuned till the end for a bonus section on ISC short and long answer questions and a board-approved marking scheme, so you are not only familiar with the question patterns, but also know what examiners are looking for. Let us start with the inverted U, which is one of the most important and most asked questions in board exams. The relationship between stress and performance is not linear. More stress does not always mean worse performance, and less stress does not always mean better performance. The relationship is curvilinear. When put on a graph, it forms an inverted U shape. This relationship was first described by psychologists Yerkes and Dodson in 1908, which is why it is also called the Yerkes-Dodson Law. Let us break it down into three parts to understand this graph a little better. Let us start with the left side of the curve, which indicates too little stress. When stress or arousal is very low, performance is also low. There is not enough activation to motivate effort, sustain attention, or drive engagement. The person is thus under-aroused, bored, understimulated, and not invested. Mild stress below the optimal threshold produces low performance, not because the task is too difficult, but because the person is not sufficiently activated to engage with it fully. The optimal zone, the peak of the curve. As stress increases from this low baseline, performance improves. At the peak of the inverted U, performance is highest. This is the huge stress zone. The challenge is real and meaningful. The person is activated and focused, and performance reflects that activation. Finally, the right side of the curve indicates too much stress. As stress increases beyond the optimal level, performance begins to decline. The person is over-aroused, anxious, distracted, and overwhelmed. Cognitive resources that should go to the task are then diverted to managing the stress response. The ISC syllabus specifically identifies 4 types of stress level conditions that reduce performance. The first is stress that is distracting, where the stressor itself pulls attention away from the task, such as a personal crisis distracting a student during an exam. The second is stress that is mild but sustained. Even stress below the optimal zone, if prolonged, produces fatigue and reduced engagement. The third is stress that is prolonged. Chronically elevated stress eventually depletes resources and impairs performance, even if it was once at the optimal level. The fourth is increasing difficulty levels. As the task becomes harder, the optimal stress level drops. So the same amount of stress that was once optimal becomes excessive as complexity increases. This connects to the Yerkes-Dodson refinement. For complex tasks, the optimal level is lower than for simpler ones. Beyond the optimal zone, at the extreme right of the curve, the person may be unable to function at all, paralyzed by anxiety, or overwhelmed to the point of breakdown. This is where chronic stress transitions into health consequences that we examine in the rest of the video. So what does this law mean practically? The inverted U tells us several important things. First, the goal of stress management is not the elimination of stress. It is the regulation of stress to the optimal zone. Second, different people have different optimal zones. What feels like stimulating pressure to one person feels overwhelming to another, which is why stress responses are personal rather than universal. Third, being too relaxed before an important performance, like an exam, a presentation, or a match, can actually impair performance, just as being too anxious does. A degree of activation is necessary. Now we come to the second section, which looks at the effects of stress and health. I have divided this into 4 or 5 different sections, so it's easier for you to study. The first effect looks at the effects of stress on the immune system. The scientific study of connections between psychological states, the nervous system, and immune function is called psychoneuroimmunology. As we already perhaps know, the immune system defends the body against infection, disease, and foreign cells. It consists of multiple cell types, including white blood cells, B cells, T cells, and natural killer cells that identify and destroy pathogens. But how does stress suppress immunity? The primary mechanism is cortisol. Sustained stress keeps cortisol chronically elevated via the HPA axis. Cortisol has a direct immunosuppressive effect. It reduces the production and effect of immune cells. In the short term, this makes physiological sense during a fight or flight emergency response. The problem arises with chronic stress. The immune system is chronically suppressed, leaving the body genuinely more vulnerable to infection, slower to heal, and less able to fight existing disease. Research consistently demonstrates this. Wound healing is significantly slower during sustained stress. Students show measurable reductions in immune cell activity during exam periods, and people under prolonged caregiving stress show consistently higher rates of illnesses. Now we come to stress and hypertension. Hypertension means persistently elevated blood pressure, the force exerted by blood against arterial walls. Normal is approximately 120 by 80, but hypertension is readings consistently at or above 130 by 90. During the acute stress response, the sympathetic nervous system constricts blood vessels and accelerates the heart rate, immediately raising blood pressure. When stress is chronic, this elevation is repeated continuously. Over time, arterial walls are damaged, they stiffen and thicken, sustaining hypertension even in the absence of active stress. What are the consequences of this? Well, hypertension is called the silent killer. No symptoms for years while causing progressive cardiovascular damage. Consequences include elevated risk of heart attack, stroke, and kidney damage. This also leads to wider heart problems. Stress affects the heart through multiple pathways, and heart disease is one of the most serious and well documented consequences of chronic stress. So, what are the mechanisms? Well, directly, the repeated SNS activation and blood pressure elevation of chronic stress place sustained mechanical strain on the heart muscle. The heart must then work harder against increased arterial resistance for years, weakening it progressively. But indirectly as well, chronically elevated cortisol promotes the deposition of fatty plaques in the walls of the arteries, a process called atherosclerosis. As these plaques build up, the arteries narrow, restricting blood flow to the heart muscle itself. When a plaque ruptures, a clot can form that blocks coronary blood flow entirely, causing a heart attack. Additionally, stress also triggers the release of adrenaline, which can cause abnormal heart rhythms, especially in people with pre-existing heart conditions. There is also a link with personality called the type A connection. The link between type A personality patterns, specifically the hostility component, and coronary heart disease is well established and directly relevant here. Hostile, cynically suspicious individuals show greater and more prolonged cardiovascular reactivity to stresses, accelerating all three pathways. Let us now turn to the effects of stress on ulcers. Peptic ulcers are sores in the lining of the stomach or upper small intestine. For most of the 20th century, stress was considered their primary cause. But in 1984, Marshall demonstrated that most peptic ulcers are actually caused by a bacteria called Helicobacter pylori, for which he and his colleague received the Nobel Prize. However, stress remains a contributing factor through two pathways. It suppresses the immune function, making pylori colonization more likely. It reduces the protective mucus lining of the stomach and diverts blood away from digestive organs, making the stomach wall more vulnerable to acidic damage. Stress ulcers, a distinctive category, develop accurately in the response to extreme physical trauma, like a major surgery, severe burns, or critical illness. These are not H. pylori driven. Moving on to diabetes. Diabetes is a condition in which the body is unable to properly regulate blood glucose sugar levels, either because the pancreas do not produce enough insulin, type 1, or because the body cells do not respond properly to insulin, type 2. So, how does stress contribute to all this? Well, during the stress response, the body needs rapid energy. Cortisol and adrenaline both raise blood glucose, mobilizing energy stores for the fight or flight response. In a person with normal glucose regulation, this is a temporary and self correcting phase. But in a person with existing diabetes or a pre-diabetic vulnerability, this repeated stress-induced glucose elevation significantly worsens the glycemic control, making the condition harder to manage. Additionally, sustained cortisol elevation promotes insulin resistance. The cell's reduced responsiveness to insulin, which is the central mechanism of type 2 diabetes. Chronic high cortisol therefore not only worsens existing diabetes, but may also contribute to the development of type 2 diabetes in vulnerable individuals. Stress also affects diabetes indirectly through behavior. Stressed individuals are more likely to eat poorly, reduce exercise, neglect medication, and sleep less, all of which worsen diabetic outcomes. Moving to stress and asthma. Asthma is a chronic respiratory condition characterized by the inflammation and narrowing of air pathways, causing episodes of wheezing, breathlessness, chest tightness, and coughing. How does stress worsen asthma? Well, asthma has a significant psychophysiological component. Stress is one of the most consistently identified triggers for asthma attacks, alongside physical triggers like allergens, cold air, and exercise. The mechanisms are multiple. First, the stress response produces physiological changes in the respiratory system. Stress hormones can trigger bronchitis, the narrowing of airways that cause an asthma episode. Second, chronic stress promotes systemic inflammation through sustained cortisol and immune dysregulation. The airways of people with asthma are already inflamed and hypersensitive. Additional inflammation from chronic stress amplifies this baseline reactivity, making attacks more frequent and severe. Third, stress impairs immune regulation in ways that may directly increase airflow inflammation and sensitivity to environmental triggers. Asthma, like diabetes, is therefore best understood as a condition where stress does not cause the condition from scratch, but substantially worsens its severity and frequency in people who already have it. Now that we have covered all the effects of chronic stress, this is a quick, helpful reference slide with all 6 health effects of stress and their key points. This is a helpful one when you need to revise. As you can see, each operates through a distinctive biological mechanism. Burnout is one of the most important and practically relevant concepts in this chapter, and the ISC syllabus explicitly categorizes this as work-related. Burnout represents what happens when work stress is sustained at high intensity without adequate recovery over a prolonged period. It is defined as a state of chronic, work-related stress leading to physical and emotional exhaustion, cynicism and detachment from work and its recipients, and feelings of ineffectiveness and reduced personal accomplishment. Burnout was first named by psychologist Freudenberger in 1974. The comprehensive research framework was also developed by Christina Maslach, who defined burnout in terms of 3 specific dimensions. Note both these names for your ISC exam. Let us look at Maslach's 3 dimensions. Dimension 1, emotional exhaustion, the core of burnout. The person feels depleted and emotionally drained. They have given so much of themselves over such a sustained period that they have nothing left to give. They describe feeling used up, wrung out, and empty. This is particularly acute in professions requiring sustained emotional engagement, like healthcare, education, social work, and counseling. Dimension 2, depersonalization or cynicism. A cynical, detached, sometimes callous attitude towards the people one serves, clients, patients, students, or colleagues. This is a protective distancing strategy, pulling back emotionally when reserves are depleted. For example, a nurse who stops remembering patients as people, a teacher who stops caring whether students understand. This is not a character flaw. It is what sustained emotional depletion looks like from the outside. Dimension 3, reduced personal accomplishment. A pervasive sense of ineffectiveness. The feeling that one's efforts no longer make a meaningful difference, that the work one used to manage now exceeds one's capacity. This often creates a self-reinforcing spiral. Exhaustion leads to reduced effectiveness, which confirms the sense of failure, which in turn deepens the burnout and exhaustion. Like I mentioned before, burnout is most associated with helping professions: medicine, nursing, teaching, social work, and emergency services, because these roles combine high emotional demands, sustained exposure to others' distress, limited control over working conditions, and often a culture that discourages seeking help. But any work context where demands chronically and significantly exceed resources and where there is insufficient recovery time can produce burnout. High pressure corporate, legal, and financial environments show elevated burnout rates. Student burnout is increasingly recognized as a significant problem in high pressure academic settings. But what is the difference between burnout and depression? Well, burnout and depression certainly share symptoms like fatigue, hopelessness, and reduced engagement. But burnout is initially work specific, while depression is pervasive across all life domains. Untreated burnout frequently develops into clinical depression. I have also given a table below distinguishing burnout and depression, which is a helpful guide. Coming to the exam tips section of this video, the ISC syllabus lists 6 specific health effects. All 6 can appear in exam questions, and each needs a brief explanation of the mechanism. Know them as a list: immune system, hypertension, heart problems, ulcers, diabetes, and asthma. For the inverted U Yerkes-Dodson law, 3 zones are important: underarousal, which is the left side of the curve; optimal, which is the peak; and overarousal, which is the right side of the curve. The 4 performance reducing conditions from the syllabus are important as well: stress that is distracting, stress that is mild or insufficient, prolonged stress, and stress combined with increasingly difficulty levels. Complex tasks have a lower optimal arousal point. Remember that. It can also come as a reasoning question. For burnout, work-related burnout, importantly, 3 dimensions are very important: emotional exhaustion, depersonalization, and reduced personal accomplishment. Remember that helping professions are most at risk. Also remember that burnout is work-specific, while depression is pervasive. Now, let us do 2 very important graph-based ISC board questions. These are exactly the kind of questions where students lose marks, not because they don't understand the graph, but because they don't write the conclusion in the ISC style. So I'll show you exactly what examiners are looking for. Let's look at the first question. First, always observe the axis carefully. On the x-axis, we have anger level: low, moderate, and high. On the y-axis, we have relative risk of coronary events. So take a minute to answer this question, and then we will go on to discuss this. Let us start with what the graph shows. As anger level increases, the risk of coronary heart disease also increases. People with high anger levels have the highest risk of coronary events compared to people with low anger levels. Now listen carefully because this is important for boards. The question says draw any one conclusion. That means you do not need a very long explanation. ISC examiners are mainly checking whether you have correctly identified the relationship shown in the graph and stated it clearly in 1 or 2 sentences. So, a perfect ISC style answer would be: higher levels of anger are associated with a greater risk of coronary disease. Or, as anger increases, the relative risk of coronary events also increases. What are some of the common mistakes students make? Many students start by giving a theory about stress, personality, or heart disease. Do not do that unless the question asks for an explanation. So for graphs, keep it direct, mention the trend clearly, and use words like increase, decrease, or associated with. Let us look at another question. As always, take a minute to read the full question and answer it yourself before we discuss it. Now, this graph is extremely important because this is the famous upside-down U-curve, also called the Yerkes-Dodson Law. Part 1 says, explain the findings in relation to stress and performance. Now, in ISC psychology, examiners want 2 things. First, identify the principle. Second, explain the relationship clearly. So, your answer should start like this. The graph shows the upside-down U relationship between stress and performance. It explains the performance improves as arousal or stress increases, but only up to an optimal level. At moderate levels of stress, attention, motivation, and performance are highest. However, when stress becomes too high, performance begins to decline because excessive anxiety interferes with concentration and efficiency. This is the full answer that you should write, and these are all the points that your answer should cover. Why this answer gets full marks? Because this answer works with the principle, it names the principle, it explains both sides of the graph, it mentions the optimal performance and arousal, and also explains why performance drops later. This is exactly what ISC examiners are looking for. What are some of the common mistakes students make? Students only often write stress affects performance, which is too vague. You must explain performance first increases, reaches an optimum point, and then decreases with excessive stress. Let us now turn to part 2. Any two factors that contribute to stress affecting performance. Now, this is where many students panic because the textbook gives long paragraphs. But remember, the question says, any two factors accepted. So your job is to identify the factor and explain it briefly and clearly. For factor 1, you can focus on stress causing distraction. You can write, even mild stress can distract a person from the task at hand. The person focuses more on unpleasant emotions, worry, or anxiety rather than on performing efficiently. Basically, when you're stressed, your brain is busy thinking, what if I fail? What if I mess up? Instead of focusing on the actual task. For factor 2, you can write about the excessive arousal reducing performance. So arousal improves performance only up to a certain level. When stress becomes too high, anxiety increases and performance declines, especially for difficult tasks. Any additional points you can think of? I can think of one. The more difficult the task, the lower the level of performance or stress needed for best performance. Complex tasks require calm thinking, so high stress will affect them more. Another optional extra detail a lot of students can also write is about burnout. If stress continues for too long, burnout can happen. The person loses motivation, energy, and interest, which further reduces productivity and performance. You can pause the video here if you need to go back and revise any of the answers I mentioned. Make sure to cover all the points that I mentioned in the answers to get full marks. We will now look at one of the exam marking schemes to see how examiners identify the key terms. This is an example of the examiner's marking scheme for this question, where I have highlighted all the key points examiners look for in yellow. For 2-mark psychology answers, examiners usually reward for correct psychological terms, brief explanations, and direct relevance to the questions. You do not need textbook paragraphs. Short, clear, psychological language always scores better than long, confusing answers. Final exam tip. When you see graph questions in your board paper, 1. Remember to read both the axes. Step 2. Identify the trend. And lastly, state the relationship clearly. And for explanation type questions, always start by defining, then explaining, and then connecting it back to the graph or concept that has been asked. That's all for this video. Remember to like, share, and subscribe to ACE ISC Psychology for more exam-oriented content. In the next video, we will finish off the stress chapter with the last video covering stress management and stress management strategies. See you in the next one.